and Petrina Lawrence is the chair of his Community Advisory Council.
And I wouldn't still be the chair if Todd hadn't got into the position. First, I'll just give you a bit of history from myself, is that I was diagnosed with juvenile rheumatoid arthritis when I was only a toddler, so I was in the health system very early. It was sad that it took till I was 16 for a new trainee doctor to come and take me out of a 4-bedroom at Shenton Park, where the other 3 ladies were discussing how bad their arthritis and were wanting the best sort of upping the stakes. This doctor took me around and so I said, oh look, just come around the corner and I want to have a chat to you. And so I thought, yep, okay. And he said, how are you? And I said, oh, this ankle hurts, this. He said, no, I'm not asking that. I'm asking, how are you? How are you feeling? How are you coping? What is important that you want to do? That doctor made my journey forward so different, because he actually gave me permission to then, and he very nicely came and saw me every time before the consultant's round to make sure that I was confident enough to point out what was important for me to do. It then went on to the point that when we finally decided that yes, I could finally find a surgeon who would do a hip replacement on a 20-year-old when the next youngest person was an 84-year-old. But that surgeon said, yes, fine, if you just need to be able to get off elbow crutches and walk, and that's what's important, you're prepared to accept that it might only last for a year or 5 years. He was happy to accept what was important to me was the most important thing to do. That same surgeon, though, did put a stipulation on the next hip replacement that I wanted to do a jump out of a plane, and he organised, we did the tandem jump 2 weeks before I was scheduled for the hip replacement so that he could fix the previous one if I stuffed that up. He now admits that he actually retired to the vineyards and I actually sent him to drink, but he's very happy there, so that's very good. So it means that I had a very early introduction to standing up for myself. Rheumatology at that stage was a lot different years ago, as far as that my little friends at Princess Margaret, we didn't have a high survival rate, so we did pass away from the drugs of what the side effects were. And so therefore you grew up of either you were the sort of something that was not newly bad, hard to diagnose. My parents were told they were being neurotic when they would take me in because I was in so much pain and things like that. But I've come to the stage now that I actually speak to juvenile rheumatoid children that are coming through now who you wouldn't even know that they've ever had that condition unless they've got the recessed jaw, and they go and have the plastic surgery for the jaw. The treatment is so good that they're in constant remission, and so I count myself lucky that I've seen those changes. But it's made me realise how strong a voice you can have as a consumer and as a patient. I then went on to work for Consumer Affairs, so I actually got into the bureaucracy and into the government of how to check through. I coordinated in the call centre and listening to people and how they work things. When my mother was diagnosed with early onset dementia at age 61, my father just happened to diagnose as renal cancer around that time as well. So I took early retirement and looked after them. And then my journey began at Royal Perth. My mother was going through emergency in the ambulance, and the first thing they did was separate me from my mother. She didn't know at that stage, she still knew who I was, but I was her safe person. And their response of why they had to go through is, oh no, a nurse has to come in and change her, and then you'll be allowed to go through. They were the longest 20 minutes of my life and what's going through. So little old me decided, well, okay, if I want to make a change, I'll lodge a complaint. I did lodge a complaint. I got a nice thing back saying, oh, we're really sorry and it shouldn't happen, but that's the process, and that was it. So therefore, I was with Carers WA, and they said, why don't you get on the Consumer Advisory Council at Royal Perth Hospital? So began my journey in 2012. I joined this council, which when I joined only had 4 consumer committee members and 4 staff. So yeah, definitely equal information there. And as it progressed, I suppose my main thing is that I saw that the national standards and everything are driven for greater consumer engagement. And there'll be a greater need for consumers and their valuable voice. But we're just striving to meet the standards is not better health. We need to be doing more. And that's where I was at the stage with Consumer Advisory Council in that the council was made up of, in our case, 12 members. And we had representation on probably about 2 or 3 standards. Our strengths were limited by the members' recent and relevant experience at Royal Perth. Our weakness was that we didn't have the numbers to expand and to provide a sustainable resource to Royal Perth Hospital. How could this be managed? Then Todd arrived with his wonderful strategic engagement plan. I threw my hands up and said, yippee, here we go. 5 drafts down the line, we came, and it went back and forwards to the Consumer Advisory Council. We got impact. The biggest thing about that was that we actually had buy-in by the hospital. We had an executive director. We had a director of consumer engagement. We had a budget given to the Community Advisory Council, to the engagement officers. We were looking at recruiting 80 to 100 consumer advisory reps. But part of it meant that we were disbanding our old one on August 2015. I will forever remember that date. Because only a few of the members were going to come forward with us, and everyone had to go through a recruitment and interview phase. People told us that we wouldn't get many applications. We have over 100 applications. And the Community Advisory Council that we've got now, of the 15 members that sit on that, and that we actually don't report to Quality and Safety or to the Customer Liaison Officer. We report to our own Director of Consumer Engagement. And I report direct as Chair to Arish, our Executive Director. So it means that it's actually lifted the whole plane. So it means that the first thing that our Consumer Advisory Council did was that we actually have people who have had a mental health child, go through paediatric, through to transition to Royal Perth, how they're coping with that. We've had patients that are actually got their treatment currently split between Royal Perth and Fiona Stanley for cancer treatment. We have heart conditions and things. Now, in amongst all those, we actually do sort of have a surgeon, we have a nurse, we have health professionals and that, but their main idea of being on our Consumer Advisory Council is as a consumer of Royal Perth Hospital services. It has made my job as chair so much easier because I now go to meetings and we've just got so much input from those people. But the other buy-in is that we have got input from the committees. We are now I just got our 27th request for another committee to have representatives on. So in 6 months, we've gone from only having 3 representations on standards to 26. That's pushed by staff. We had picked up that one of the things that Community Advisory Council said about with surveys of going into outpatients, and we'd run a survey, a pre-one in October last year, and picked up that members did say, oh look, and that, what is your position at the hospital or whatever. And we were able to show them our ID and say, volunteer, Community Advisory Council or Consumer Engagement Rep. Oh, okay, I'd love to talk to you. That's fine. And the idea was that we actually did that. We did it on using Monkey Survey. We went back, and what we had timed is that those surveys were actually done the morning of our CAC meeting in the afternoon. So that the CAC could have straight away talk about what some of those responses were. The Monkey Survey report was available the next day. So from that, we know that there is something to work on. We're not there yet. We're getting so many different things, but Royal Perth Hospital is on a different path. We're looking at greater consumer engagement. It's what matters most to the consumer, and that will be the patient, the carer, the support worker of the people. And it's changed the focus of the whole hospital to concentrating on what consumers from the hospital and how hospital staff can meet the wants and needs of consumers and carers. To approach patient care will naturally mean that the standards will be covered, as our surveyors said when they saw our strategic group. There is little doubt that the consumer advisory councils and committees will continue to be a source of consumer engagement across the health sector. However, as Royal Perth Hospital, I feel, has identified, consumer involvement needs to be embedded in every aspect of the organisation to give true representation and authentic feedback. Thank you.